Hello there, many thanks for joining us on Joy Assoye Live today. Well, we are being joined by Dr. Douglas Emeka Okor, a consultant neurosurgeon and a respected advocate for health reforms in Nigeria. Dr. Okor has long argued that the challenge of delivering primary health care in Nigeria is not simply one of funding, but of governance, accountability, and sustained institutional reform. Now, recently, the federal government approved a disbursement of 32.9 billion naira under a revised funding framework for the BHCPF. This funding is intended to support more than 8,000 primary health care centers across the country, with expansion to, according to the federal government, 13,000 facilities under the new phase. As we face persistent questions about the dilapidated state of many primary health care facilities, the uneven capacity of local government delivery mechanisms, and the challenge of translating funds into improved health outcomes, this interview would explore whether this injection of funds is sufficient and wisely directed, what reforms are needed to ensure sustainability of improvement, how accountability, workforce infrastructure, and community engagement must align for real change to happen. So much to discuss on today's edition of the program. Dr. Okor, thank you so much for having time for us this evening.
Thank you, Joy, and thank you, ADBNT, for having me. This is actually a fantastic studio that you guys have here. Well, thank you for having me.
Thank you so much. It's always wonderful to have you. This is Joy Assoye Live. Again, we are discussing the healthcare sector and proclamation by the federal government of a disbursement of 32.9 billion naira to improve PHC facilities in Nigeria. But Dr. Okor, again, I welcome you to the studio.
Thank you.
Right. Now, from your vantage point in clinical practice and health advocacy, how would you characterize the condition of primary health care, first of all, before we get into the federal government disbursement or announcement of disbursement? What would you say about the condition of primary health care facilities in Nigeria? I mean, you're on ground today.
Well, so basically, I'll just say that when you look at like what's supposed to be the bedrock of any healthcare system in any serious nation, that the primary healthcare system in Nigeria is practically non-existent, and that's the truth. Practically non-existent. You know, so it does not work. It's really broken. We have a generally broken healthcare system, but the primary healthcare system is basically almost non-existent.
That's really sad to hear. You know, you didn't mince words. Is it as bleak as you say? Because when you listen to certain individuals, especially public healthcare, public office holders, ones around this health sector, you kind of have some hope, and they paint this picture of a revamp that's ongoing, and Nigerians should expect that our primary healthcare facilities will be better. It's quite sad because it's the closest to the grassroots.
So basically, but you can see I'm wearing scrubs. I'm not looking my finest today, and this is basically because just before I actually came here to this studio, okay, I was in one of the far-flung areas of Abuja, basically the Kuje local government area of Abuja, okay, in a community that has roughly maybe about 15,000 people, and actually walked to what's supposed to be their primary healthcare system in a nasty, terrible situation. Okay, and that's supposed to be the place where all the women in those 3 hamlets that make up that village, where they actually go to actually give birth and stuff like that. Absolutely terrible. So that's just an example. Remember, this is in the Federal Capital Territory itself. So expand that to all the 774 local governments and expand that to the almost 9,000 wards in the country and stuff like that. It is terrible. Of course, you're looking at the issues of affordability and accessibility as well. And when you start looking at the picture of when you're actually throwing out figures like 139 million poor people in the country and stuff like that, it is a struggle generally, truthfully.
I mean, there's no argument there. We've recorded, as a journalist, it's often very saddening. Mortality rates are not getting any lower, and these are avoidable fatalities. It's very sad.
If we, as a people, as a government, as all the key players, will take something like health seriously, it can be changed. only if we are serious enough.
I mean, Dr. Douglas, you and I have this conversation over and over, especially on Joy Asonye Live platform, over and over, where it's not rocket science. And this came as a solution, or it came, I don't know how you would see it. It came as some relief to a lot of people when we saw that news, 32.9 billion naira to be disbursed. But I would like to ask, how did you find the announcement of this disbursement? How did you find it?
Okay, so the key thing is that there was a red letter. Okay,
so
let's start with the red letter. So the first question is that what does
that's from the Minister of Health?
Yes. So well, let's say it's from the Federal Ministry of Health and Social Welfare, isn't it?
Right.
Okay, of course, the anchor person is the Minister of Health. Okay, so the first question we might ask is, what does the color red connote? Okay, why is it a red letter? So it connotes something that you want to bring attention, danger,
urgent,
something urgent.
Right.
That's what a red letter. Or red, that was it connotes. And basically, what the Federal Ministry of Health and Social Welfare was trying to do with this letter was to sort of, you understand, like push like a call to action, or a call to the people of Nigeria, the communities in Nigeria, call to their conscience. Okay, and this call, okay, was inspired by what you just talked about, this disbursement of this 32.9 billion naira, isn't it? Now, the key issue that we should look at is, okay, this 32.9 billion. And remember, one of the key things that they said in that letter is that this is like the third round.
The third round of
so that means in 12 months, most probably there are going to be 3 rounds of disbursing roughly the same amount. We can sort of hazard that guess, isn't it? Roughly the same amount. Okay, this is probably going to be the last one because we are almost entering November, isn't it? Okay, now the key thing is that what they've said is that they've approved and release this amount of money that we've talked about, okay? And this amount of money is supposed to be going to the commercial accounts of the primary healthcare centers in every ward, and I underline that, every ward. Okay? So the question you would ask is that, how many wards do you have in the 774 local governments in Nigeria? Okay? So let's just say roughly, averagely, maybe about 9,000.
Right.
Okay? So if we say, okay, let's just average that and say, okay, maybe the Federal Ministry of Health is talking about a primary healthcare center facility per ward, isn't it? But realistically, how many primary healthcare centers do you have in a ward? You definitely have more than one, isn't it?
Absolutely.
Okay, so in fact, you have numbers going to something like almost more than 30,000 primary healthcare centers. Okay,
right.
But like I said, let's average
modest,
it out.
right.
Let's be modest. Let's say 1 per ward. So if you were to take 32.9 billion naira, okay, and divide it by 9,000 wards, you're going to get 3.6 million naira per primary healthcare facility, which is less than $2,500. Okay, so from the point of view of looking at the red letter and saying, okay, what are they trying to do? They are trying to inspire this sort of call to action by the community in terms of looking at things like how they can push for accountability, how they can take ownership of how to actually look at the funding and looking at healthcare delivery, and all the key players within communities actually coming together to try and work all these things out, and everybody being interested in it. So from that point of view of looking at the philosophy of it,
right,
not a bad idea. Okay? You're trying to call to action, you're trying to inspire and stuff like that. Okay? But realistically, looking at this amount of money, which when at first glance, do you understand? At first listening to the amount and stuff, it sounds like a very huge amount, isn't it?
But by the
time you now break it down,
okay,
looking at making that division with about 9,000 words and getting 3.6 million naira, which is less than
let's give context to this. What are the gaps that you have noticed? I mean, that this funding would address? Is it infrastructure? Is it drugs or consumables? Is it human resource? Is it data? What are those gaps that you notice? And why do you think 3.6 will not make a remarkable change?
So, Joy, you've stole some of the things from my mouth. Do you understand? In terms of some of the key things that you need for a primary healthcare facility to actually work, isn't it? And you've actually just enumerated them. Okay, you need a human resource for health, people who know what they are doing in terms of like a healthcare workforce at that level. Okay, you need power, solar, for example. You need water. You need basic equipment to actually in that place, isn't it? Okay, you need what I call health information and communication technology. You need those platforms. Okay, now less than $2,500 for a particular healthcare facility, realistically, okay, realistically is a paltry sum of money. Like I said, from the philosophy of trying to say, hey, let's inspire communities across the country, they also to try and make sure that they're actually pushing for their primary healthcare centers to work, looking at accountability, looking at funding, looking sure that all these things that we've talked about that you need to actually make a primary healthcare facility work and stuff like that. 3.6 million naira, realistically, really? No, not really.
Right.
Not inspiring. Okay. So one of the key things I always say is that think right, act right, and spend right. Okay. One of the major problems a significant number of Nigerian citizens are having at the moment in terms of looking at the way our governments are actually doing things is about prioritizing. Okay, we are a low-income country, so that means you don't have all the money in the world, you don't have all the resources in the world. Right. So the question is, how do you want to spend those limited resources? Okay, I gave you an example of where I went today. You can see the stark poverty. Okay, even we used like because what we went was like a medical outreach and stuff, to try and support the community and stuff like that. We used some of the primary school there, so you could see the primary school, no chairs, nothing. Okay. Now, one of the key things in terms of looking at how you actually develop a country, okay, you have to make sure that your fundamentals and your foundations are actually strong.
Exactly.
And the things that you must, not just looking at education generally and health generally, the basics. So what this red letter was about the basics, was about primary health care. Right. Okay, and if you're saying that you're throwing out trenches of money from the level of the federal government and looking at the third round, you're throwing out 32.9 billion naira, coming roughly to about 3.5, 3.6 million to each facility.
Facility, right.
Okay, it is not good enough. Okay, it's tending towards almost looking like, oh, is this some sort of propaganda? Is this really serious in terms of? So that's why when you look at the reason why I'm actually breaking down this amount of money is that when you if you're trying to inspire communities across the board in the 774 local governments and stuff like that, saying, hey, hold your primary healthcare facilities strong. Make sure you're looking at spending and stuff like. When they see this kind of amount of money, 3.6 million naira, less than $2,500 or so, coming to their community and stuff like, that's not really going to inspire anybody. I'm sorry. That is the truth.
You're probably right, but you know what we say in the local palace at all. We've been asking for something. Don't you think this would be that something? It would is a paltry sum, but it could fix one or two things.
Well, so again, think right, act right, spend right. Okay. The main problem here is that if it was a situation where when you look at the way our governments are spending money and what they are spending money on, okay. And you now look at that comparatively and say, okay, you're a government to actually serve the people, impact in the people's lives. And I'm not just talking about people in your city, for example, maybe in the what do you call it, maybe in Lagos, in the island in Lagos, or maybe in the capitals of the states and stuff like that. You have a significant population of Nigerians who are outside those places.
Absolutely.
Who need healthcare, who need education and stuff like that. So if you're spending money, I'm sure the average Nigerian knows what our governments at federal and state levels, what they actually spend money. I'm not going to go through that today. We all know it. But when you're looking at those amounts of money going to those things, and you now look at balancing things out and saying, okay, what should we actually prioritize with spending money? And you now calculate, looking at 3 rounds of in terms of trenches of money going out, and you now calculate that for a ward, 3.6 million naira is coming to a ward for health care for a people who are very, very poor. And you look at all the key things that you actually need to actually provide healthcare at that level, at that basic level and stuff. And we've run through them in terms of the healthcare providers themselves, in terms of water, solar power and stuff like that, and equipment and stuff like that. And you're getting 3.6 million, average of maybe 3.6 million naira 3 times in a year. Joy, seriously. Okay, so if it was a situation where it was so bad that no revenue at all, you're getting 3%, good. But when you're looking at what monies and resources are going into, and you're looking at state governments building flyovers and stuff like that, and you actually ask, how is this impacting in the average citizen?
Right. Okay,
and then you're now coming down and seeing this red letter, and you make those calculations and stuff like that. It's a little bit very uninspiring and very demotivating. I won't lie to you. I suspect that I speak for the average Nigerian.
Oh, okay. Now, another thing we must address. I mean, we saw what happened during the COVID-19 and the funds that were injected and how it was utilized in spite of the paltry sum. Are you also concerned that there will be no accountability? Yeah, and that's another kettle of
So,
fish right there. But is it something that also concerns you? Do we have
well,
mechanisms down?
so here is the problem, okay? Like I said, the philosophy of the red letter, very, very good. You're trying to inspire people, okay? You're trying to call them to action. But I'm saying it's not going to work, okay? Now, because it's not going to work, you're actually really not going to inspire anybody and stuff like that. The average person in this community is not going to waste his time and say, oh, okay, now, oh, this 3.6 million that has actually come to my community and stuff like that, how do we guard it? Oh, let's make sure that the 3.6 million, no, it's not going to happen. So from the point of view of citizen participation with respect to actually pushing for accountability, not much is actually really going to happen. I'm talking of from the citizens now.
Right.
From other key players outside government, non-governmental key players, not much is actually really going to happen. I won't lie to you. So if your question is, okay, from the government side, are they going to actually put in mechanisms through proper, robust accountability mechanisms that are actually going to actually help? You know, with mainstreaming these funds and stuff like that? Based on our experience in this country and stuff, do we trust that that's going to happen? Probably not. Probably not.
Well, so what are the risks that funds may be disbursed but facilities remain underutilized? Because hypothetically speaking, the federal government listens to you right now. The minister pushes for more funds and all of that. We still have that gap where Nigerians don't even trust the primary healthcare centers. We see what's going on with traditional birth attendants, for instance. It's still very rife because we've recorded instances where women go there to get medical attention and there's nobody there because, I mean, who wants to stay in a dilapidated facility, right? So what should we start fixing? And fixing fast.
Oh, well, I've said this again and again and again.
And it seems like there's always need to say it again.
So the key thing is that we just need our governments at all levels and all of us, Nigerian citizens, all the key players to just remember and have that light bulb moment that healthcare is not an afterthought. Healthcare is a mainstream priority. We must prioritize it in our body language, in our policies, in our interventions, in the way we spend money. Okay, so what, for example, this red letter now, look at the way we are spending money. Okay, this is not a very inspiring and motivating way to actually spend money. This is paltry sums of money, very paltry. Okay, 3.6 million naira in a primary healthcare facility will basically not do anything. That is the truth. Let's not lie to ourselves. Okay, but we cannot talk generally about, okay, funding for primary healthcare. Because one of the things I've even proposed at one point is that a significant number of the funding, whether be it at federal level, state level, or local government level, when you talk about pushing money to healthcare, should actually go to primary healthcare. A significant number. I don't know, I can pick a figure from my head. I can see that probably maybe up to 65% of money that goes into healthcare in Nigeria should go to primary healthcare. Okay, because that is the bedrock. Okay, clearly, when you look at our local government system, extremely weak. Clearly, last year we had the Supreme Court judgment that was supposed to actually be making our local governments autonomous. Okay, so clearly, when you look at our laws, look at our constitution, look at different things and stuff, they are there. But in terms of implementing them, how many local governments are actually properly financially autonomous since that verdict? That Supreme Court verdict.
Is there
any
even?
So there goes the problem. So first of all, your primary healthcare centers, facilities are supposed to be domiciled normally with the local government. Absolutely. That's what we look after it. Okay, so we know that they don't have the resources. Okay, so what's the next bar? State governments. Okay,
that's
so
what you should expect naturally.
So there's this key talk about, since we actually remove the subsidy and stuff, there's more money going to the governors and stuff.
Yes,
like
FAC allocation.
So more FAC allocation going to the governors. So how much of that is now going to primary healthcare? Realistically, how much of that is going to primary healthcare? If we were to do a survey now in the 6 geopolitical zones and stuff, and go and pick one village, one rural area, and go to your primary healthcare center, and survey the people and stuff like what feedback
would we get?
Do you think we would get in terms of Do you understand? Our state governments are really trying. Do you understand? In this our local government and this our what they are really putting forward money. Oh, we have very good healthcare workers here. Our community health extension workers, our pharmacy technicians, and the rest of them and stuff like that are doing very, very well. In fact, if you go into our primary healthcare center, you can see that they have digital platforms and stuff that they actually use. If you go there, they have a solar system that works. They have a borehole, works very, very well. You understand? All the people within that community, and so when they actually go in there and stuff like, they actually have at least some fundamental of basic, do you understand, safe and quality care and stuff like that. Please, do you understand? If we were to do seriously, if we were to do a survey at this particular point in time, okay, on the 28th of October 2025, what do we really think we'll actually get from those places? So it's easy to actually write a red letter to try and say, oh, you want to actually inspire and motivate people, call them to action in terms of the, but realistically, when you now throw in 32.9 billion naira and you break it down to 3.6 million naira per facility, and you see that each local government area and stuff is very weak financially to actually really do anything for the primary health care centers, and the big questions are on the state governments as to whether they actually truly tracking down to actually really support those primary healthcare centers. You just get bewildered and actually just scratch your head a little bit and wonder, why?
Are we really serious as a country? Right.
I'm telling you that, again, not looking at my finance because I'm coming from a community, far-flung community. The roads to the place were terrible. The key thing that we always talk about that we should spend our money on, again, think right, act right, and spend right, are at least from a foundational level, basic healthcare, basic education, and relevant infrastructure. I underline relevant.
Right.
Okay, if you're throwing an airport in a state that really doesn't need that airport, and the people are suffering, their primary schools are terrible, their primary healthcare centers are basically broken down, not functioning at all. The roads to the different villages where there are farms and stuff like that are not working and stuff like that, and you're building an airport. Wow.
Well, that's a good place to go for a short break. Believe it or not, we're going to have hour into this conversation, and we are still discussing this disbursement of 32.9 billion naira to increase access, help the vulnerable, underserved communities and rural areas, improve the healthcare facilities in those communities. Is it enough? Is the question we are asking now. But what would be enough is the question I would like my guests to address. Discussing Nigeria Health, the facilities, and how the 32.9 billion naira, what it can actually do. But my question now is, what would success look like for you, Doctor, and what are your recommendations? I mean, 3.6 is obviously not going to address the challenges and gaps within the healthcare facilities, but what would be?
I think, Joy, the key thing is that we just need to repent.
Repent?
I'm telling you the truth.
And who are we? When you say
yes,
we...
From top to bottom, vertically and horizontally.
Right.
We just need to repent. Do you understand? All the way from, do you understand, the executive in terms of the federal government, the state governments, the National Assembly, the State House of Assemblies, do you understand, the ministry departments and agencies. Do you understand? We just come across as not understanding and having the mindset, do you understand, of what a country that is glorious and a country that knows what's supposed to be doing for its people should be doing. Okay? Again, I say it. Think right, act right, and spend right. Okay? If your thinking and your philosophy is not one that governance is about impacting in the people's lives,
right.
Do you understand? And you just think that, oh, governance is about a few people just bunching up somewhere, do you understand, squandering very scarce resources and stuff like that. Unfortunately, not much happens. Okay? We have a second chance, another chance now. Okay, 2027 is coming. All the politicians are going to be jostling here and there and stuff like that. My major worry, Joy, is that all the key people that should be, you understand, turning arms, bending arms and stuff and asking very key questions are staying aloof.
Everything is just politicized.
You understand? The people who should be, you understand, because one of the things that I say is that when you look at the kind of people, the personalities and the philosophies that guide them within our political space and stuff like that, you have a particular kind of people and a way of thinking and stuff like that. So don't expect that those people just on their own are going to have a light bulb moment and a hallelujah moment and stuff like all of a sudden change the way they think and start thinking that, oh, okay, now, oh, we are
That
now going
makes
to
no
we are now
sense,
going to
right.
be for the people. You know, so we are now going to make sure that everything we do, basic education, basic healthcare, to that last man in that rural area and stuff like that, we're not going to do it. It's not going to happen. So that means that we need sustained positive pressure. But my pain, Joy, is that the people who should be putting pressure are staying aloof. Like you rightly said, everybody wants to play politics.
Right.
The professional health organizations, all the way from the nurses, the physiotherapists, the radiographers, the doctors, the dentists, and stuff like that.
Why do you think that is?
I think the middle class and professional class in Nigeria is really failing Nigerians. Okay, because you have these three classes, isn't it? You have the political elite, you have the middle class / professional class, and then you have this significant number of people who are very poor, who cannot speak for themselves, who are very ignorant, poor. They are struggling out to
I mean,
their livelihood.
I understand being poor, but I don't know if they are ignorant
It's
because they do see the lacuna. They do get there and they do not have optimal service.
No, no. What I'm saying is this. Yes, they might not get optimal service and stuff like that, but I'm telling you, the average 139 million people now who are poor in Nigeria and stuff like that,
Right.
they don't know. They don't know what
they should.
development is. What development actually means. What does it mean to develop a country? Okay, development of a country doesn't mean that in your capital you have flyovers and stuff. That's not what
Right.
development is. You can have flyovers in your country, but if you have 133 million very, very poor people who cannot access basic education, they cannot access whatever and stuff like, you have failed as a country. Okay, so the key thing is that from a foundational point of view, look at countries like China, Indonesia, and stuff like that. The Asian tigers. How did they pull people out of poverty?
Right.
How did they spend their money? What were they spending their money on at different times? So am I saying that, oh, you don't need flyovers and stuff like that in the city? No, that's not what I'm saying. But I'm saying if you have limited resources, what do you spend money on first? Okay, how can you pull a significant number of these 139 million people out of poverty? What do you spend money on? It is your basic education, your basic healthcare, your relevant infrastructure, and of course, looking at the way Nigeria is, that we really need to spend money on security, isn't it? You know, so again, the failure more is actually more on the middle class and the professional class. The middle class and professional class, unfortunately, are hoping that they can actually cross to the political elite class and stuff like that. So they keep quiet as well. Okay, and say, oh, hopefully it will become my turn and stuff like that. But the key question, or the key thing that really bogs my mind, is that how long can we continue like this before something gives? Because this is not sustainable. We can't continue behaving like this in terms of the way we spend our resources, in terms of the way we come across, especially from a government point of view, that you don't actually care for the people.
Dr. Douglas, you just mentioned the professional bodies. And I mean, a lot of you, from nurses and all medical personnel, walk around that space. You see this decadent right in your face. I mean, nobody has to put their face out there. As an association, you could push for it. Why are we not seeing that? We have several bodies within the health sector.
So you've just said it. It's just that lack of courage, lack of that ability to look at the bigger picture of things. Okay, so you now have a significant number of people, groups, and stuff like that, communities that are now very narrow-minded and actually very short-sighted. Okay, everybody wants that quick, oh, how can I do something that actually benefits me and stuff like that. Okay, that ability to actually look at the bigger picture and say, oh, can we actually push for something that benefits everybody?
Everyone.
Okay, so philosophically and culturally, generally at this particular point in time in this country, we don't have that thinking of, hey, let's push for something that actually benefits everybody.
Okay,
and
so
it is really sad.
again, let me ask the question, and I would like a more direct response. What would you like to see? What would be a sustainable reform, especially when it comes to primary healthcare facilities? What would you like to see if you think the government is serious?
Better organization.
What does that even mean?
Better organization. So that means better organization, cooperation, and collaboration. Okay. When they launched the 1212, the what do you call it? The I forgot the word. Their renewal something initiative for healthcare in 2023. Okay, 12/12/2023, which was the Universal Health Coverage Day and stuff like that. One of the things they talked about was pushing for the sector-wide approach.
Right.
Okay, where you
I remember we had that conversation
absolutely,
at the time.
and the way you have all the key players coming in and actually bunching up money together and pushing and stuff like that, and making sure that that at federal government and state government level that they actually deploy their resources to things like basic healthcare, for example. Okay, so that's what organization means. Organization means that sector-wide approach, people pulling together health under one roof. Okay, that's what it means, organization. Number two, we need proper funding. not $3.9 billion coming 3 times a year and stuff like that, and like 3.6 million naira going to a facility.
Exactly.
Okay, that's not what we want. Okay, we want more of those funds, and we want funds from the state governments as well. Especially now they say that their purse is swollen from FAC, and so that we need more of those funds to actually go to healthcare. Okay, now remember, the sector-wide approach means that there's collaboration between the states, the local governments, and the federal government, isn't it? So, for example, 3.6 million naira going to a particular facility, isn't it? But also state governments also sending that as well. But the key thing is that who is actually working that fund, who is using that fund appropriately and stuff like that. So there need to be proper mechanisms of accountability, of monitoring and evaluation.
Absolutely.
Do you understand? Especially at the local government level, okay, with reporting strategies as well that report to the central, to the Federal Ministry of Health. And what do you need for this? You just need good digital platforms. Okay, you just need good digital platforms that actually talk to each other.
Good digital platforms. I mean, I've gone to some primary healthcare facilities, and when you say good digital platforms, and naturally, I'm just thinking about it. I didn't see a computer.
It's far-fetched.
So it's far-fetched for me right now.
But that's what I'm saying.
I did not as much as see a computer.
So that's what I'm saying, that instead of spending money on airports, on on flyovers, on conference centers and stuff like that, I'm saying spend most of those monies on your primary schools, on your primary healthcare centers, on roads that are going to the villages, to the rural areas and stuff like that, on power, do you understand, solar, using the full whatever of power, being it gas, whatever, and stuff like that.
Right.
Do you understand? And yes, that's what it, spend money on those things. Okay, and then when we've gotten to a particular level and stuff like that, then you can start doing bridges and flyovers and stuff like that. Does that make sense? Do you understand? So again, think right, act right, and spend right. If you understand, if your philosophy of development means, hey, the amount of money we have, we put it to the people, we spend it on the people, we raise the bar of the people's lives and stuff like that, and the people live a more fulfilled lives and they contribute more to society. And then when you get to a particular level, you now say, okay, we've now gotten to this point now where we can actually now start doing flyovers, do airports and stuff like that. Okay, so it's about how you actually spend your money and when you spend that money. Like I said, go back and look at the Asian tigers, China and stuff like that, and actually ask yourself, how did they pull? China pulled in about 20 years. They pulled about 400 million people out of poverty. What were they spending money on? When they started, were they spending money on bridges and flyovers and stuff like that? I don't think so. They were spending more on education, healthcare, and stuff like that, and relevant infrastructure. That's what they were spending. Power.
Well, it is what it is. Now we have like you have broken it down, about 3.6 million naira per
facility.
Per facility, primary healthcare facility.
Well, per one facility in a ward. Okay, because there are probably other facilities
in the ward. I was careful to say per facility. I hope that is. And while that is really sad, my question now would be, if you have a staircase conversation with, say, the minister right now and here, what would you tell him? What would you tell him he should do right now? What's your advice or suggestion as to how he can make this better?
It's just basically the minister just goes, sits down with the president and say, hey, Presido, Your Excellency, okay, if you truly want to impact in the lives of Nigerians, yes, we keep saying in our government, Mr. President, that, we've built up revenue and stuff like that, and then moving from next year, early January next year, there's going to be the personal income that we're going to pull in more revenue and stuff. And just say, Your Excellency, the best way to spend this money, okay, is in key things that actually push human development index, basic healthcare, okay, basic education. And in terms of infrastructure, can we change the way? And also, Mr. President, it won't be bad if we can actually call all the governors, okay, and call their commissioners of education, commissioners of health and stuff like that, actually sit down with them, and actually have a serious discussion with them about all these things. I say, hey, we need to actually deploy our resources differently that can truly impact in people's lives.
Right.
Okay, and of course, like I said, you now have that more organization of them actually working together and stuff like that, and actually throwing all the accountability mechanisms and all the monitoring and evaluation mechanisms as well.
Now, speaking about responsibility, you rightly mentioned the governors whose allocation is increased at the moment. Do you think Nigerians are informed enough to know they can even hold their government to say, you can't, for crying out loud, you cannot let us use these dilapidated or facilities as our primary healthcare facilities to run to for emergencies? How can we awaken that need from the community, community base upwards?
So I think it is tricky. It's tricky because the kind of system we run in Nigeria is supposed to be a federal system, but it's more centralized, isn't it? You have more power in the center. Okay, so there's a tendency for a significant number of the population to look to the president and the federal executive. Okay, but like you rightly said, the governors, they have more resources and they should be doing more. But again, it goes back to the same thing again. A significant number of people are poor. A significant number of people are ignorant.
How can we awaken
and then
the
again,
right.
again, also the middle class and the professional class in those states as well are also playing politics again. So how can you do it? Again, you just keep, the media has a lot of role to play.
Right.
What you're doing now as Joy as Sony Live and stuff like that, this is very key. Putting the message out there, keep hitting hard.
Right.
Keep hitting hard at that door and stuff like that, and trying to especially awake the professional class and the middle class and tell them, hey, you're not doing your job. Okay, you are failing the country, because guess what? You are the ones that can actually speak for most of the people that actually don't understand where their left from their right.
Right.
Most of them struggling out to AK life, they even struggling to even find their daily meal and stuff like that. So the middle class people are the ones who can actually articulate what should be for the other people. And I want to see more of people like the professional health associations coming on board. Faith-based organizations, definitely civil society organizations. I always call in the Nigerian Bar Association and stuff like that. I want to see more people talking about what development should mean, and actually keep repeating it to the politicians across board, vertically and horizontally. Clearly, of course, the executive nationally, and the subnationals, the governors as well. Okay, we need at different levels. We need to keep telling them and reminding them that development is not just about doing fine things and building fine buildings and stuff in your city centers and stuff like that. It is more about impacting the people's lives and spending on things that are actually going to achieve.
Right,
yes,
like
spending right, spending on things that are going to enable people's lives. Okay, a significant number of your population. If you're not spending money in such a way that is actually doing the right things and providing governance to a significant number of people, you are playing to the gallery. And I won't lie to you, for a long time, especially you can say even since we started democracy from 1999. Okay, we have not, our governments right from time, they also have not been spending on the people, on things that actually improve the lives of the people. Basic healthcare, basic education, relevant infrastructure, and now the security.
Wow. I wanted to go into even monitoring what we've got, but how do you monitor something that's so paltry? So I'm a bit. I want to keep positive, but it's a bit a bleak situation, because when you look at the whole structure of things, I am a bit concerned that Nigerians typically do not care much about health until it happens to you personally, and you're like, aha, things are not right. So how do we also, amongst Nigerians, to say, let us prioritize health and have that conversation? The media, like you said, is very important.
They play a significant role.
Yeah, they play a significant role. Yeah. But we've had instances where, I remember during, they talk about financial autonomy for local government, where the media championed it. Oh, okay, let's have that financial autonomy. There was pressure. Every media organization was saying something about it. And when it came, you saw the local government chairman themselves telling you, I dobale for my governor. Any direction he wants me to go is where I go. And as a matter of fact, when I get my allocation, I'll still submit it to the governor. So that's how I see the situation in health, where we are not interested until it does happen to you and you're like, aha. And the very unfortunate time Nigeria happened to me, but you could have said something.
I think generally, we have, clearly, I speak about health most of the time because I'm mainstream in health, isn't it? But clearly, when you look at different sectors of our life, we are broken in multiple places.
Absolutely.
We are broken, and we need fixing of these multiple things that actually affect us. Okay. Now, respect to healthcare, like you rightly said, usually at different levels, both horizontally and vertically, healthcare is usually an afterthought. Painfully so. Okay, but I can tell you, I've been back in Nigeria now, okay, for the past 9 years, and the discussion about health as a sociopolitical, a mainstream sociopolitical issue and stuff like that has actually improved. It's actually much better compared to before. And clearly, when you look at the young people in Nigeria, okay, especially those who are very internet savvy, social media savvy, and stuff like that, they are more attuned now to actually discussing the issues about
right.
Nigeria. So what the picture I'm trying to paint here is that it's not all doom and gloom. It's not all doom and gloom, but we need to keep hitting it. It is not a sprint, unfortunately. Okay, when you have a broken system like ours, it doesn't change overnight.
Right.
Okay, you need to keep hitting, and hitting. Okay, when you have more Douglas Emeka Okors, okay, who are speaking about these issues, actually telling truth to power, and actually analyzing it and saying exactly the way it is, and not pandering to any political whatever, and actually saying, hey, no. Do you understand? The people are suffering, and actually also also giving vibes of, oh, these are the possibilities of what we can do, of how we can make these changes and stuff like that. Not just being an armchair critic. Do you understand? And actually saying, hey, this is what we can do and stuff like that. So, for example, I talked about this red letter, and I said the philosophy behind it is good. You're trying to inspire people and stuff like that, but realistically, no. Okay, realistically, when you look at the amounts that are going to thread down to the primary healthcare center, it just churns you a little bit in your stomach, and what just screams your head, oh, propaganda. Okay, maybe it's not propaganda, but unfortunately,
right.
in this part of the world, that's what is going to scream to a significant number of people. So again, okay, you ask that question, but I'm going to restate it again. Okay, if I had the ministers here, I would tell me, go back to your principal, go back to His Excellency, do you understand, the president, and tell him, say, presidency, we need to change our style in terms of what we are spending money, especially this one that I'm actually in charge. You've given me a portfolio to be in charge of. Healthcare is central. It is central. 17 sustainable development goals. If you want to develop, number 3 is healthcare. I cannot see flyovers, bridges, airports.
Infrastructure is
way at the back.
Right.
Healthcare is number 3 and education is number 4. If you want to develop, but if you want to keep playing to the gallery and doing propaganda and doing that, then continue the way you're doing. But again, I've asked that question: how long is that sustainable before something breaks, and something breaks really seriously, irreversibly? Hopefully that doesn't happen. Hopefully.
Right. Well, Dr. Okor, thank you so much for being part of the program. It's always very wonderful to have you, and your energy is palpable.
Yeah, because the Nigerian patients are worth it.
The Nigerian patients are worth it. I mean, that's a phrase that you coined several years back. The Nigerian patients are worth it. Thank you so much for the work that you do.
Thank you.
Thank you for contributing to this conversation. I hope that you're being listened to, because it's a very important conversation, and I hope that indeed we would see the change necessary, even if it's in phases. But before I let you go, I would like to ask: are you positive that we will come to? I mean, having followed the Nigerian system so far, that we will get to a point where this doesn't suffice. It's obvious it doesn't suffice, and we find the announcement for disbursement for more to say, you know what, that was a certain phase. We are going to inject more, as we have seen that this only was able to say what handle very little to improve the facilities.
So you're asking me for my hope. Of course, everybody hopes.
No, I'm not asking for your hope.
Okay.
I'm saying looking back and looking at our trajectory, is it something to expect?
No, I won't expect it. But remember, see again, for each what is the tenure? Okay, for a president or for a governor in this country,
typically
it's 4 years, isn't it? And they can get re-elected if possible and stuff like that. So nobody is going to stay forever. Okay, the hope is that we keep pushing, we keep pressing, and at some point, hopefully, people will come into power that actually understand the dynamics of what it means to actually develop a country, okay, sustainable development goals, okay, and then start, putting the right muscle, and actually start spending money appropriately.
Okay. Well, I just hope this is not one-off. Thank you so much. That has been Dr. Douglas Emeka Okor, a consultant neurosurgeon and a respected advocate for health reforms in Nigeria. Thank you again for being part of the program.
Gracias.
This has been Joy Asanya Live. I've had a wonderful time talking about our Nigerian healthcare facilities and healthcare sector and all that needs to be done. Indeed, the Nigerian patients are worth it. Yes. Have yourself a wonderful evening, as we would return another time for more.